they're fixed on it. And they could have a low reaction or a very over-the-top reaction to things in the environment. This can be anything from colors to sounds. Sometimes kids on that spectrum will need to wear headphones in loud places because the level of noise bothers them. So sometimes you'll see that. A lot of people, it just depends, okay? But for them, their senses can be heightened. Okay, so those are some ways that you can know. And now they're diagnosing kids much earlier, as young as 2. They can, and that's actually a good thing because they can also intervene. And with early intervention, these kids do way better. They can work with them and really, really help them. We have a school out by Menards. I don't have any idea where I am in this building right now. But up by Menards, there's a school there for kids with on the autism spectrum. It's really cool. They do good stuff there. So, social and emotional reciprocity. So, usually not going to carry on a conversation with you, or very little. They may not be huggers or touchers. Okay, so we would consider it a win then if we have a child with Asperger's who does not like to be touched, who I can now shake their hand, right? When I greet them, that's a win, because before this is not happening. So now we're having that touch social interaction, okay? And then also getting some communication. So these are the areas we're looking at: social, emotional, communicating, and developing relationships. Whereas so if you have a couple of 7-year-olds playing, now 7 is an age in which kids play together, okay? Versus like at 2, they play next to each other. They don't actually play together, they play next to each other, but by 7, they're interacting, they're playing. And so you would have a couple of kids, and if one of them was on the spectrum, in all likelihood, they would be playing by themselves. These other kids are here playing, but they're playing over here, so we're looking for that interaction, okay? So those would be wins, okay? So different ways you can tell for assessment. Look at how they interact with the parents. Okay. Do they allow picking up, cuddling? Do they allow that kind of bonding interaction? Do they make eye contact? Sometimes you'll see delays. Sometimes this is how it's picked up. When a kid gets around 2 or so, they start to fall off the curve in terms of things that we usually expect. There's those little developmental milestones, and all kids are different, so we can't freak out the minute one of them doesn't hit something, but we then just want to pay attention to seeing, is this kid coming along or not? And 2/3 have a comorbidity for mental health condition, oftentimes anxiety. So that's really important for us to know also, okay? So we talked about early intervention already. So for nurses then, be thinking about things that would tell us that we're making progress. Social interaction, verbal communication, okay? The ability to have physical touch, those would be wins, okay? My neighbor lady, we've known her forever. She's babysat my kids. She's like one of them people that babysits everybody's kids that you just love. She has a grandchild that's on the autism spectrum. And it was the weirdest thing. I went to her house, and he was probably about 3 and a half, something like that. And he's one of a set of twins, and the little girl doesn't have it. And so, she's tootling around, talking and whatever. And this little boy just came up to me and raised his arms up for me to pick up. And, she was out of the room doing something, and I picked him up, and I'm just holding him and talking. She came into the room, and she was like, "Oh, my God." And I said, "What?" And she goes, "He does not let people pick him up. He does not let people touch." And I was like, "Ah," "Oh, look what I did here," like nothing. It was absolutely nothing. Apparently, it was in the right place at the right time, but that was just kind of cool, I was like, okay, that's pretty neat. So, yeah, that was a win for him. Okay, so ADHD. So the thing to know about ADHD, right, because we won't talk a lot about it for adults, it's the same in adults. We used to think people outgrew it, they don't. What they can sometimes outgrow is the hyperactivity component. So if a kid is running around and you can have attention deficit with or without hyperactivity, and kids can have that hyperactivity, and as they get older, that part, God bless, can go away, but it's still there. The disorder doesn't leave the building, it doesn't. So now you see this, we just really call it ADHD, hyperactivity, or no, that's just what it's called. Again, mild, moderate, severe, just depends on what's going on with the kid. And it's all about focus and concentration. And if they're hyperactive, that bounciness. The best way this was described to me is like, if I've said this before, somebody stop me. Did I talk about the room, the octagonal room? Did I already talk about this? All right. So you're in this room, you're in this classroom, and you've got, window over here, over here, over here, over here. And outside of here, it's nice, so we're gonna say that our windows are open. Someone's mowing the lawn, and back here there's construction going on, and over here somebody's walking their dog. And over here there's a couple ladies sitting on a bench. And then I'm up here doing my thing. For the kid with ADHD, they are hearing that, and that, and that, and that, and this, and you tapping your foot, and you tapping your pen, all of it at once, okay? They have zero ability to pull the blinds down, metaphorically speaking. Whereas you, without ADHD, can pull the blinds on all those things. Put your attention here, and leave it here. So, what they look like then, sitting there, right, is like this. Ooh, what are you doing down there, And they're getting up, and getting up, and getting up. Because they have this, especially if they're hyperactive, right? They gotta move, And our oldest has this, and we had like a little small table in the kitchen for the small people. We just put her food on the table, and I didn't even bother with the chair. Because seriously, she would come by, keep on going. And I was like, I was like, she gotta eat, There was no trying to pin that kid down. My mom would get so frustrated, like, make her sit at the table. I'm like, are you kidding me? Because then she's up there and she's, hanging out, doing that, like, too much work. So when it comes a problem though, right, is when we get to school. Because we need the focus and attention for sustained anything. Try to finish anything, right? It doesn't happen. So to get the diagnosis, it scales. They talk to parents, teachers, anybody they can get that has a kid for any length of time is what you're looking for. And they're all going to do the same scale, and then they're going to compare, is basically what happens. It's frustrating because people with ADHD seem not to be listening or paying attention, but they do hear what you're saying. But they really, their eye contact, can be really poor. And so, if you're talking to someone and you're looking everywhere but at them, they're like, what the heck, but they do get you. So behavior modification, parents need a lot of education and a lot of training. And usually a stimulant medication if the parents feel that it would be beneficial to their kid. Some people don't, and that's okay. The kids need a routine that is really solid, that is not messed with. Kids thrive off a routine anyway, but kids that are hyperactive really need routine. You have to ignore the non-harmful behaviors. I have a brother that's 10 years younger than me, and we would go to church on Sunday, and he would do the most ridiculous things. I remember him, he was like quacking like a duck or something. Sitting next to me, and he was going, quack, 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 like this. And of course, I was like mortified. I was like, do something about that, and my mom was just, but that was kind of what that was, because he could be in trouble all the time, because he was always doing weird stuff like that, but that was sort of part of this. And so it was like a choose your battles kind of thing. If it's not hurting anybody, let it go, because these kids are also often in trouble a lot over their behaviors, They're bouncy and they do stuff impulsively. That's what happens then. They become very impulsive. So, if you yelled at him, you'd be yelling at him every 5 seconds for doing something. So you gotta kind of pick your battles, okay? And then what happens is low self-esteem follows, right? With our oldest, this started when she was 3. When it's your first kid, you know nothing, right? You're like literally the dumbest person on the planet. And so we didn't know anything was any different than anybody else's kid, because why would we? But every day when I would pick her up from preschool, her teacher would have a laundry list for me. She did this, she did this, she did, and it was bad. Bad. And of course then I'm like scolding her because I don't know the difference, You need to have her tested. She has ADHD, you need to have her tested. Well, I don't know what to do about that. Okay, all right, go to the doctor, and he's like, well, I don't even know where to send you because she's 3. So we did the thing, and they were like, first of all, even if she did, we wouldn't treat her at 3. Come back when she's 6 or 7. Okay. So, but what we did figure out is, it was really detrimental to her to have to be scolded every day because then her self-esteem suffered. So when she was 6, after kindergarten year, which was a real rough one, we did go have her tested, and she did have ADHD, and we made some other decisions. But the truth is, things for her got much better after that. Because, she wasn't getting yelled at in school every 5 seconds. She could sit and focus and finish, her work or whatever. So for these kids, when they do hyperactive stuff, like I had a friend over one time, she had her kids with her, and she pushed one of them off my porch. Just, for nothing, probably for something. I don't know, her brain for something, for my brain, kid comes in bawling, she pushed me off the porch, and I was like, the thing is, like, they get these feelings, right, these emotions, like, right now, and because they're impulsive, this looks like a good idea, So we have to separate them out, sit them down, like, give them something to do, and then talk about it, So give them something to play with, give them something to occupy them. Let's talk about that. What's going on there? Were you mad? And like, separate them from the situation, and help them through that. And so the stimulants work just like we talked about in the farm. They help them focus, they help them with their memory, their concentration, and they also do calm them down. So before we did stimulants when she was very young, she got a lot of coffee, and I got a lot of weird looks. But it works different for her. It does. Coffee, chocolate, all of that stuff with caffeine calmed her brain down. So, there we were in the IHOP with our coffee, her this big, but, it worked. So we're looking at behaviors that way, okay? Interventions, lots of parent discussion. Also, parents need to understand that there are things like the Americans with Disabilities Act, which means that teachers have to provide accommodations for their children. So if you have a child with ADHD, which is considered a disability, the teachers have to accommodate the child so they can best learn. So allowing them to use things like fidgets, everybody know what a fidget is? I think the fidget spinner thing went a little crazy. But there's all kinds of things for them to do with their hands. Ours actually wrote a note for her to chew gum, which of course her teacher would not allow. Because if she has gum, everybody has to have gum. So not true, but anyway. Chewing gum, using her hands, and I think a lot of people do, when you guys study, probably listen to music, things like that. It was another way to keep her brain busy and allow her to focus and do her thing. But they have to do that. Technically, they have to do that. So, and parents don't know these things. You don't know any of this, when you're doing this. So if you're in that position and you're working office or wherever you are and you're helping parents out, let them know, hey, these are your rights, so you need to look into that. Any questions about any of that stuff?
Can ADHD be diagnosed after the age of 12?
It can. It definitely can. She asked if it can be diagnosed after the age of 12. It can be diagnosed at any time in your life.
Okay.
Some people grow up with it. They have no idea that's what was going on in their life until they're older. Did you have a question, Tempest?
Yeah, just like if the doctor said that your child had ADHD, but you didn't feel that they should take medication, would you get like in trouble for neglect if their behaviors like, okay.
No. The thing about medication is, it is a really personal choice, and you have to weigh out all the things. How your child is doing is probably the number one thing that people have to look at. It's an interesting thing. People feel like they have all kinds of rights to opinions. When we opted for medication, I had nurse friends that I worked with. You're not going to put her on medication, are you? And it was kind of like, well, none of your business, but yes, we are. But the truth is, we looked at it from a standpoint of what was beneficial to her, because she couldn't work to her potential. She's got a brilliant mind. She could not even get through a one piece of paper thing. She just was everywhere, And it was constant fighting with the teachers. It was constantly being in trouble. And we wanted her to be able to do her thing. You know what I mean? And we were willing to try it and then stop it if it didn't work. That's the other thing. You know what I mean? Some of it's a little hit and miss. There's one drug that is a non-stimulant medication for ADHD. And so that's out there too. So some parents have to try that. It works differently. So yeah. Okay, so before we talk about adults, I'm going to read you a little something. stay awake for it. I might lose my place a few times, that usually happens. Some of you may have known this young lady. Her name is Jenna. And this happened in 2018, and it happened locally. So bear with me, you know the story. This was written by this little gal's mom. This is my daughter, Jenna Marie New. She was born June 2nd, 1998, and died January 2nd, 2018. She had 2 large blood clots in her pulmonary artery. One was 2 inches long. Although she wasn't given a long life, she has a story I feel needs to be told. I need to advocate for her, as I always have done, only this time I need to do it publicly because there are so many things that need to change in our society. Jenna died from natural causes. She also suffered with mental illness, an illness that shaped the way people treated her. I saw her illness the same way some look at cancer. It was real, it could be deadly, and there is treatment for it, but not always does the treatment work. The big difference is the way other people in the medical field, the school, and much of society as a whole look at it and how they looked at her. Compassion is given to people diagnosed with cancer. Jenna did not receive the same compassion from many, especially those in an industry that is supposed to be caring and compassionate, the hospital. She started having symptoms that were noticeable in upper grade school. She later said that around the age of 5, she felt depressed, separated, but didn't know what it was or how to verbalize what she was feeling. She was socially awkward. It was difficult for her to make friends and even more difficult to keep them until her most recent years. Her particular illness caused her to look at things very differently than a person not suffering from it does. She felt her lies were justified until she learned that they were not. Sometimes she lied just for attention. Sometimes it was to get out of a particular situation. And sometimes she convinced herself that her lies were indeed that she still needed love, understanding, and support and patience with boundaries to love her unconditionally. As parents, we all love unconditionally. With mental illness, it takes a really strong conviction. It became increasingly difficult to help her because there's not much support out there for people who are mentally ill. Fortunately, we found fantastic therapists that helped us all. At one point during her teen years, she struggled so badly that she ended up in the hospital, a residential treatment center, and eventually a therapy boarding school in West Virginia. Illinois didn't have what she needed. Second hardest thing to burying her was leaving her in another state. It also ended up being the best thing we could have done for her. She learned how to understand many things that I was unable to get her to see. You see, access to mental illness is a really hard thing to understand and treat. Remember, access to is personality disorder. After her high school graduation from Greenbrier, she struggled again. Her medications were hard to get balanced, and she went from a constantly structured, monitored environment to life without a net, and it was very hard for her. She was hospitalized again numerous times. Each time the nurse and physicians in the ER would treat her like a burden, not believing what she was telling them. I understood some of that because she did lie about what was going on sometimes, and sometimes she really felt what she was feeling. Mind is a powerful thing. Just because it doesn't show up on the screen doesn't mean she wasn't feeling it. Many times she was dismissed as if no one cared, treated like she was less than. Over the last several months, she had finally gotten the right combination of medicine. She felt good. She felt good about herself. She was a nanny and loved it, and the young girl she was taking care of. She had a purpose and was really good at it. She gave more than what was expected of her. She worked hard. She was really happy for the first time in a really long time. She was in a place where she was working on the things in her life that weren't working for her. The morning she passed away, she called me at 5:30 and said she passed out and was having difficulty breathing. When the ambulance brought her to the ER, the first physician she saw asked her in a very snotty tone, "Who said you had a seizure?" He should have been looking at her vitals, which were not right. She told him the EMT witnessed her having a seizure, which she couldn't even remember. She only remembered passing out. I heard him then go out to the nurse's station and ask the same question. Her seizure was witnessed by an EMT. Her blood pressure was low, yet he was dismissing her again and questioning her symptoms. She was in obvious distress. One of her nurses didn't believe she could get up to give a urine sample, which for some odd reason they desperately needed, and threatened her with a catheter. I could tell when they came in the room, they weren't really going to put a catheter in her. They wanted to scare her and make her get up to go to the bathroom. They eventually got a wheelchair, and when they brought her back from the bathroom, she was gray. She had passed out trying to get up. It wasn't until they switched shifts and another physician came in that they acknowledged she was in real distress. I had to ask why her blood pressure was so low. She had a seizure while I was alone with her. I had to call in a nurse, and someone there finally witnessed her seizure, and things started happening fast. Now, I know in my heart there was nothing that was going to save her. There wasn't enough time, and no one knew what was happening to her soon enough. She was so young that they weren't looking for a blood clot at first. After her death, we learned that Jenna had leg pain. Unfortunately, she always had something that made her uncomfortable, so she must have dismissed it. I cannot honestly say that I wouldn't have dismissed it also. Complaining was really part of who she had become. The medication she took caused her to be heavy, which also contributed to blood clots. She had many risk factors. This last part here she bolded. What I do not understand and want to really ask is why compassion isn't what it used to be to every patient. Why is it lacking in our hospitals? Why isn't mental illness treated like an illness? I want one nurse or one doctor to read this and think about how they are treating patients with mental illnesses. I want one mentally ill patient to understand how important it is to be honest about what you're experiencing. I want one teenager to read this and try to understand that someone may not act the same as you, but instead of judging them and treating that person so badly, show some compassion. Why is there not more education? Physicians, nurses, police officers, teachers, and anyone who comes in contact with mentally ill patients need more education about it. How many even know what an access to mental illness is? Let's start there. Let's make a difference. Sincerely.